name's Tina Marie. I've been HIV positive since 1997. I was diagnosed with hepatitis C in 1998 and diagnosed with AIDS in 1999. At the time I was diagnosed with AIDS in 1999, I was also pregnant with my son, who is now 10. And at the same time, I had to go into treatment for drugs and alcohol. My son was born negative from hepatitis C and from HIV, so that I was really grateful for. Lately, it's been really difficult. I'm starting to feel a lot of body aches and pains. Sometimes they say the medication is really hard on the body, and the HIV itself ages you. Some of the resources that we have are really great. We also have support groups with COPE, support groups with SAFE, which is Southern Arizona AIDS Foundation. CPSA, sometimes we can get support from.
What's a word of advice that you would tell the community on
that HIV and AIDS is still out there and that anybody can get it? You don't have to be a drug addict or an alcoholic or gay or anything. My circumstances were a little different because I happen to have an addiction background and I wasn't really happy with myself. I was more kind of on the suicidal route, but other people can get it without having to do those things. All you have to do is be with one person and not communicate and not use protection. And even with protection, you can get things. So my advice is just to really communicate with partners and make sure you both get tested.
You said you were an addict before HIV was happening in your life. Has that changed you over the years?
I had HIV for 2 years in my addiction. It took me 2 years before I actually wanted to really get sober. Once I got HIV, I kind of thought, oh, now I have HIV, I'll just use and drink until the day I die. And I didn't really care about living anymore. But when I became pregnant, that kind of changed things. And I decided at that point to change my life for my child and for myself. So sometimes I see HIV as a benefit and a curse. You know, there's like two sides of it. It's like yin and yang, kind of.
So you're more stable now than you were before?
Yeah, I'm more stable now in my life than I was before because, interestingly enough, it took a really strong disease that could possibly kill me to want me to start living again. So I think mainly the best thing to do is just to live your life the best way that you can, and if you're depressed or you have issues like that, to get help, because I didn't do any of that until after I got HIV. How
does your family support you in all this?
My mom is a really big support. I live with her. She helps me with my son. The rest of my family have kind of disowned me, mainly because of my addiction, not really from the HIV. Although I think the HIV is a factor, they don't want to talk to me or anything. So it's a shame because I'm not the same person I was when they knew me in my youth. So I just found out last week that I had an x-ray and my bones are really thin. As I'm 46 years old and the doctor said it looks like a 66-year-old in the bone area, so I'm going towards osteoporosis. The best attitude to have is to put yourself first. You know, it's not the end of the world if you don't sleep with the person because they want you to, and that they're going to leave you if you don't.
I met someone at a club and was casually involved with that person on 2 events and became infected within a few months of the relationship. Immediately I was given counseling and medical care. Being aware that people you're involved with don't often tell you if they have HIV or STDs for that matter. So it's important to protect yourself, but it's also even more important than that to be okay with who you are. If you take anything I say with you, number one is know your heart, know your emotional state, and be okay with who you are. That's the important thing.
So motivation is definitely something that has helped you deal with the changes in your lifestyle now?
Yeah. I'm in a safe relationship. We do practice protective intercourse, and we don't do any oral sex or anything like that. And the person I'm with is knowledgeable of my HIV, even though he's negative. So that's kind of hard. It's really not hard anymore because now we've been together about a year. And he's very supportive of my involvement in Tihan. And anytime you are in a relationship, or even someone you just meet for the night, you engage in transmission of body fluids, you're at risk for contracting HIV.
How often do you suggest that women get tested after sex?
Well, if a person is having a young woman, say 13 on up, if they're having unprotected oral sex, vaginal intercourse, or anal sex, they need to probably get tested every 3 to 6 months for the rest of their life.
How would you end this with a positive note?
I would say that a person can become infected and live a normal, healthy life with a chronic disease if they take responsibility in improving their lives, just like any other person who, say, had cancer, diabetes, or heart disease. A lot of people have illnesses, and HIV really is no different than any of those chronic diseases.